Hi, ciao. My name is Beatriz. I'm a fourth year resident from Portugal, from Medioav Hospital Center. And I came to Gasolini for an internship for 3 months because I love neonatology and also for my interest also in the neonatology brain. Why did I came here? My particular passion in area of the neonatology are the extreme prematures, and not only the viability it's decreasing even more, but I like that a unit there is more interest in not only in surviving the babies, but how do they survive and how does the brain will survive, and that was my particular interest. Also because it's a really well-known center for the neurological pathology, and that would also led me to manage to have some training in the ultrasound of the babies, and also comparing that to the MRI image that we saw and learning a lot about the brain and the particulars that have the neonatal brain. I think these 3 months were really incredible. I learned a lot. They have an amazing team. We saw a lot of cases, difficult cases, very intense cases, and also some very rare, and the discussions were really rich. I also got the opportunity to learn some Italian, and the time was really good. This was an important time for me to expand my knowledges, my techniques, and also to go to Portugal and to share some of the cases and some of the things that I learned here, and also to learn more also about your brain and spread the message about the preservation of the brain on neonates.
Right. And there's a technique neonatologists use to explore the baby's brain, which is the ultrasound. Could you talk about it so that parents could understand why it is important?
The ultrasound is really important. It's a non-invasive way to do an exam. It's a quick exam, doesn't make any discomfort for the baby, and it's done even sometimes, as I saw, with the parents by their side, and they could explain what they were also seeing. Particularly in the neonates, we were managing some babies were trying to see if there were any kind of hemorrhages in the preterms, but mostly the long course is to see the punctate white lesions and the effects that they could have at long terms. And that could be a really good exam to explain in a simple way to see the damage of the brain or not, to see if the brain is okay. The MRI, it's a complement. It could sometimes be completed with the ultrasound, because there are two different things. But to see the brain with a
why young people could be interested in neonatology, and particularly in neurology of the neonate?
So as a neonatologist, we sometimes, or as a pediatrician, we saw like the small days, the less short idea, and caring about the brain is caring for the future of the babies and the people, and getting to know how they are going to grow up. Preserving that with some of the respiratory techniques, and also for the control that they had about the ultrasound, it's really important for the future of those babies, not only to see how they are here and go home, but also to preserve them how they're going to be in the future, in the psychological and also physical parts of them.